So this cardiac arrest save coin presentation highlights the life-saving and pre-hospital care partnership between DC Fire and EMS and the American Medical Response, or AMR. Together, we are improving health outcomes for the patients for whom we are providing appropriate, compassionate, and responsible care to each and every day. To Lindsay Washington, AMR's Administrative Operations Supervisor, and to Mika Curtis, AMR's Operations Manager, thank you for being here today and the work you do each day to make this partnership a success. For nearly 4 years, this partnership has done many things, to include providing a new path to care for many of our patients. It has since put our members in a better position to respond to more serious and critical patients, improving our unit availability by allowing our units in our battalions to remain in their districts. But beyond all the data and the statistics, for Jerry Bartelloni, this partnership and what AMR's EMTs do every day is saving lives. So thank you. It was Saturday afternoon, August 10th, 2019, and Jerry Bartelloni, was strolling through Washington Circle with a little discomfort when suddenly he collapsed to the ground, a victim of cardiac arrest. Alert bystanders spotted this and quickly flagged down an AMR ambulance nearby. Their crew, as well as a second AMR crew, immediately began performing CPR on this pulseless victim. Racing to their assistance was Engine 1, Medic 1, and EMS 4. When their crews arrived, they found that Mr. Bartelloni's pulse had been regained through the efforts of the AMR crews, and they continued care while providing advanced life support measures. The patient's level of consciousness continued to improve, and he was placed in the ambulance, and he was even able to describe having felt chest pains before his collapse. Ironically, Mr. Bartelloni has been a patient of mine for 30 years. This was a Saturday afternoon event, and early Monday morning, Captain Kurt Hoffman came into my office excitedly shaking the EPCR and saying, "Can you believe what happened on Saturday? Somebody had a cardiac arrest on Washington Circle. They flagged down AMR. They started CPR. He regained consciousness and a pulse, and our crews finished it from there." And I looked at the EPCRs, but it didn't have his name on it. I didn't know it was Jerry. But 2 days later, on Wednesday afternoon, when I usually see patients, Jerry showed up, and my medical assistant said, "Yeah, he's kind of upset because he had a cardiac arrest." And I thought, that's crazy. How can that be? So I went in and he told me this story about being at the gym and having a little pain that he attributed to his exercise and walking to a park and then collapsing. And I said, "When was this?" And he said, "It was Saturday afternoon." And I said, "Where were you?" And he said, "The circle right there, Washington Circle." And I went, "Oh my God, that was you." I said, "I read your EPCR." And he's like, "What is an EPCR?" So these cardiac arrest save coins are presented to those that respond and assist in returning the pulse to a pulseless patient prior to transferring care for that same patient to a hospital. Those who bring back life to that same patient are provided a save coin after we get word from the hospital that the patient has been discharged in good health. So we're here today because we have living proof that such a case is here with us this afternoon. So Jerry, I'd like you to step forward to the podium. I'd like you to help me provide these save coins. So the first one, EMT Charday Curley, if you could come right up, we'll get us a save coin.
Thank you very much.
Okay. And this is the first crew that got there and started CPR on you, Jerry.
Thank you very much.
Alan Innocent.
Very much. Thank you. Thank you very much.
Alec Wilkins.
Thank you. Thank you. Thank you very much.
And Ashley Brandon.
Thank you, Ashley.
Fantastic work, and we're really excited. I think this is the first cardiac save presentation that I've been attending, where AMR crew has been the recipient. So good work. Thank you. Thank you for bringing back my patient and friend Jerry Bartelloni back to life.
His co-pays.
And for and for their representation of the department through teamwork and exceptional medical care. Today we also honor the following members with our cardiac arrest save coin. Firefighter EMT Artist Trapp. Here we go. Strong work.
All right. All right. Thank you, sir.
Firefighter EMT John Robinson. Firefighter EMT Luis Mendoza.
Thank you.
Okay. And firefighter paramedic Patrick Russell.
Yeah.
Okay. And also receiving a cardiac arrest coin but unable to join us today is Sergeant James Hughes, EMT Captain Betty Smith, and Fighter EMT DeMille Morris. So I would like Jerry to come up. And Jerry, you don't have half an hour, you have somewhat less than that. And Jerry's a little bit shy, but he and I have been talking over the last 6 months, and he's ready and prepped. So Jerry?
Yep, sure.
Right ahead.
So, first of all, Dr. Holman told me there was going to be for about 4 people, so I'm like, okay. And, I didn't realize all these people helped save my life, but I really do, appreciate it. Just a little background, I was really surprised that I did have a heart attack, so as I had gone to Dr. Holman, maybe that's earlier that summer for a physical, and everything turned out. So you just never know. I'm just thankful that I was in the right place at the right time, because it just kind of, I was just walking along, and then the next thing I know, I'm talking to somebody in the ambulance, and they're telling me they're transporting me to GW Hospital. So my recovery, I think physically I go to the cardiologist and everything's fine, but mentally it's taken me, I think right now I'm feeling a lot better than I was, and it was just such a shock to me, because I did a lot of working out, but anyway, I'm here. I really appreciate from the bottom of my heart you saving my life, and continue to do good work. Thank you.
Thank you very much, Jerry. Congratulations. So Jerry's asked me as his doctor, why he's allowed to live another 30 or 50 years, whatever it is we're going to get through. So those are the questions that we all ask. Anyway, I want to thank you again, Jerry, for showing up here today, and to everyone here today. You're all making a really positive difference with lots of people, but also for this particular individual. You have saved his life, and as you can see, he's very young and healthy, and he's going to live a long, fruitful life. So Jerry, congratulations, and congratulations to all of you.
Thank you, everybody.